Dupuytrens disease is a condition that affects commonly the hands and less frequently the feet. It causes occasionally some pain, and this develops into cords or tight bands in the palm and into the fingers that can actually limit the movement of the fingers and cause them to be bent and get in the way in everyday activities. Traditionally called the disease of the Vikings because of its predisposition in people from Northern European heritage. And this is why in Australia we will see this quite frequently through populations who originate traditionally in the northern countries of Europe. The condition usually occurs in the 50s or 60s and develops slowly over a period of time with increasing tightness in the cords, which then causes bending in the fingers. Some patients develop the condition much earlier, in their 30s, and this tends to lead to a much more aggressive progression of the disease, meaning that surgery or treatment is required at a much earlier age. Treatment for Dupuytren's disease aims to decrease the amount of tightening in the fibrous bands in the hand, also to decrease any pain or tenderness, and ultimately to try and maintain the fingers as straight as possible for as long as possible. Early treatment is non-surgical, and this is with the use of steroid injections, usually to treat tenderness or occasionally some pain in the cords, and also to treat the feet. There is also a procedure called fasciotomy, where a fine blade is used to cut through a tight band in the palm. This can be performed in the rooms with local anaesthetic and does not require an operation. More recently, a treatment has become available in the last few years, which is an enzyme called collagenase. This is injected into the disease and breaks down the abnormal collagen fibres that are causing the disease process. The brand name for this is Zyflex. This can be used for disease at any part in the hand or in the fingers and requires an injection and then a manipulation of the hand and fingers a few days later to straighten out the fingers. This can be very successful and can delay the requirements for surgery. Ultimately, surgery is often required. This is usually done as a day procedure and requires release of the tight cords and also change of the skin in the form of what's called Z-plasties, where the skin is made longer. And sometimes skin grafts are also required. There is often a requirement to release joints as well to get the fingers out as straight as possible. After surgery, dressings are required up to 6 weeks, with splints as well being used at night, but otherwise a return to normal activities within 2 to 6 weeks after surgery.